So the next talk is going to be from Alana McKay. She is a licensed clinical social worker, joined us a number of years ago, and she's been amazing. I'm going to say, nearly 20 years of experience working with patients, even experience with
It's a
prior
little bit
experience,
more than that.
maybe a little. It's more than that. Being generous here. So, but really, she has ample experience. She's been a real resource to our clinic, and has been working with Huntington's patients for a number of years now as well. And I think patients have really loved getting the advice from her. She's going to share some information with us today for our patients. I'll let her kind of take over. But again, I wanted to thank her for taking her time this morning.
So this morning, I am going to go over just some basic information from the HDSA programs and services. They have an amazing website with just tons of information on it. And I always think it's good to kind of start out from the basics, and then before you get into the weeds, that you have a general idea of things to look for. So this presentation was originally created by Jessica Marsolik. She is the head social worker at the HDSA. She oversees all the social workers who are part of Centers of Excellence and other places that help people with HDSA. I've added some updates to this because this is a couple years old now. So let's see. There we go. Okay, so when this was written originally, there were 60 different centers of excellence for Huntington's disease across the nation. There's several partner sites, and there's covering 37 states across, including the District of Columbia. So, the clinical care that are provided through provided through centers of excellence are, all the different team members that you are probably meeting when you come to our clinic. So you're seeing the neurologists, psychiatrists, social workers, therapists, and other kinds of counselors who have extensive experience in working with families who have HD and to help them plan for future care. So there are also others who are involved, clinical research, different support programs, and there's more information by using this QR code here if you'd like to learn more about that. And so we always want to give people a quick way to be able to look at the latest research. So any of these QR codes here will lead you to lots of things. I particularly like the HD Buzz. I find that to give me a quick overview of what is going on. So that's a nice way to check in every once in a while. But there's lots of different resources here if you're always wondering what the latest research is. Okay, so we have 120 plus social workers across the nation who are helping people with HDSA. So what social workers do is provide social and emotional support for both people, their families, doing support groups, giving information about community resources, helping with the disability process, kind of helping families as they're going through these different stages as a patient with HD may change, the grief and loss that comes to most of us at some point, and then just general education and advocating for people when they need extra services. So when you come to a center of excellence, there are all different kinds of clinicians, like we talked about. Social workers are a mandatory team member for us to get certification as a center of excellence. There are also chapter and regional social workers They may not have as many different team members as the Center of Excellence does, but they can also provide different resources and help you get in contact with providers. So the HDSA has a huge network of support meetings. This is done through Hey Peers. That's a secure platform on Zoom. And there are so many meetings every month for every kind of specialization. Some of them are more general groups just for people who are coming the first time, for patients and for caregivers, for people who think they might be positive but are not ready to get tested, for people who've recently got a positive result after a testing test and coming to terms with that. And so there is lots and lots of support. And these are also for our younger people who have HD. There are specialized groups for them also. We have Spanish-speaking groups, and there is a national helpline, 1-800-345-HDSA, if maybe there is some other need and you're not sure exactly where to find that at. Okay, so I would like to point out that the HDSA has some wonderful resources that they have put together, these books. You can click, well, there, I am going to ask, when this video goes up on YouTube, I didn't realize that this PDF link was not going to work from when it shows up on YouTube. So we will put that into the blurb that goes under the YouTube channel. So there's a general care guide givers for Huntington's disease. There's a way to, another pamphlet that's very helpful is communicating when you come to talk with the providers at the clinic, when it's your usual appointment, and being prepared for those visits. So there's another guide for HD families, understanding behavior. There's additional ones when people are getting into mid and later stages of Huntington's disease. There's a lot of different resources. It's just amazing what they have built up over the years. These are also available in Spanish. So again, we will put links to this in the once this is ready for YouTube. Okay, so there's the HDSA National Youth Alliance. They do wonderful things, working with the younger people. Boy, when I go to convention and seeing the younger people who are there just running around and being with other kids their age so that they actually know people who are just like them, that's just such amazing and touching to see that. So there are 4 specific youth social workers. There may be more since this is a little bit older. And again, the QR code, you would be able to look at that, and that would take you straight to that. We have the wonderful Allison Bartlett, who is the lawyer at the HDSA Society. She helps families out with disability. I would ask if you would contact your local social worker at the clinic that you're going to first. And then if there is some tricky question or maybe having difficulty with being denied for disability, Allison is a good person to help out with that. She has a whole page just on applying for disability, different things that you need to know. Disability is complicated, so having some extra support from her and from the information on the website. Very helpful. Okay. And she often sends out newsletters to, if you are on the list, to receive those from the HDSA if you're signed up with that. Okay, and then there are many different educational and awareness events. This is part of what both the Centers of Excellence and the HDSA does every year. So each year, for people who are with a Center of Excellence, there will be education days like we're having today. There are walks. There may be different fundraising and social events, just things to bring awareness about HDSA. I would really encourage everyone to try to come to the annual HDSA convention at least once. It is just amazing, the energy that is there, and sorry, I'm going to tear up when I think about this. It's just so positive. And, you know, HD is tough. Having Huntington's disease is tough. But going to one of these conventions, it can lift your spirits up amazingly. You can meet new people. You can make connections. There's lots of times to intermingle. There's tons of education. There is a walk on the first day of the convention where we go out and we're just there wearing our t-shirts and saying, you know, that we're going to get this, you know, we're going to do our best to go through this, and one day there is going to be a cure for this. Lots of educational workshops, time to sit down at big tables to eat with other folks and get to meet people that you've known across the country. So this last year, the convention was held in Indianapolis. Next year, it is going to be in Phoenix. Each year, the convention rotates between the East and West Coast. So that way, it's a little bit less to travel on certain years for some people. If you're not able to go to convention for some reason, a lot of the presentations are videotaped, and you will be able to watch these later. So, you know, say you can only stay a day or two for the convention, you can't stay for the whole time. You won't be missing anything. You will be able to go ahead and see these at a later time. Okay. And I believe that's the end of what I was going to talk about right there. Just want to mention again that we do have our own support group here. We hold ours on Zoom. This is on the third Tuesday of every month from 5:30 to 7. And if you are interested in that, you can put a note into the chat, and I can you can send me your email, and I can get you signed up for reminders of them. Okay. All right. So thank you for your attention to this. And yeah, I'm going to stop my share and turn this over to the next person.